Hi, I'm Dr. Young. I would like to talk about otoplasty, which is essentially a procedure to alter the shape of your ears and the way they appear. Oto is essentially a term for ears, and plasty is essentially the plastic surgery term for shaping the ears. And I'm going to talk a little bit about otoplasty and how it's done and some of the results you can get and what causes otoplasty and what particular things people use to determine whether an ear is too big from a facial beauty standpoint. When you take a look at this picture, you definitely see that there's something about his ears that are more prominent. There's a lot of different terms that are used to describe the way these ears appear, but essentially that ear should not extend away from the head more than approximately an iris width. Because we look at the iris so often, we use that for determining a lot of different things, and your ear should not stick out much more than an iris width, the colored part of your eye. There's a lot of different anatomical terms that you should be aware of if you want to consider otoplasty. It's not a necessity, but it helps. But the ear is consisting of a helix on the outer side, the antihelix with the different cruces or bends in the ear, the superior and inferior crus, as well as the concha, which includes the cymbalum, the cavum, as well as the ear canal. And this includes the tragus, and this is the lobule. Now this is a picture of an ear that, prior to correction, showing that he lacks a bend in this part of the ear, the superior crus. And when the superior crus, or the superior part of this antihelix here on the top of your ear inside, doesn't have a bend, it allows the superior part to come out more, to show more when you see a person. And from the frontal view, you definitely see the top of the ears come out more. And this is just a arrow showing the cymba, or the concha of the ear, and when this portion is prominent, it causes the whole ear to come out, and knowing which part of the ear causes the ear to appear in a certain way is vital knowledge in terms of when you want to approach how to correct the way the ear looks. And this is from a side view, and you can see that because of his bend, the lack of the bend in the top part of the ear, it causes the ear to come out more. Now when you recreate that bend, this part of the ear markedly comes towards the side of the head so that it doesn't stick out as much. And then as you can see, his whole ear sticks out, and that part of the reason is because this portion is markedly developed in him. The concha portion of the ear is markedly developed so that it causes his whole ear to stick out. And that's another way to approach fixing it. You have to essentially weaken that portion of the cartilage to allow the whole ear to sit back, or take pieces of cartilages out to allow the whole ear to sit back. So knowing what part of the ear contributes to the way that it ultimately looks from the front side is ultimately important to get a good result. And this is a person who had really prominent ears and wanted his ears to be set back, and was totally happy with the results. We were able to reduce the size of his concha to allow the whole ears to sit back, as well as recreate that bend in the top of his ears to get a result such as that. And he was very happy that his ears were able to come back. And these incisions are all done through the back of the ear, and they heal essentially imperceptibly in the back so that you can't see them. And this is another patient who had a lack of a bend in the top of her ears, as well as more protrusion in the middle part, and we were able to weaken this cartilage to allow it to sit back, as well as recreate that bend in the top of the ear to allow the whole ear to sit back. And she, prior to having this procedure, she wasn't able to wear her hair up, and she always was concerned about the way her ears looked. And now that she's had the procedure, she's able to wear her hair up, and she's has an upcoming wedding, and she's able to wear her hair up without being self-conscious about her ears sticking up. And essentially her ears were sticking out more than about an iris width, and we were able to put it essentially perfectly set to the amount of distance away from her head, so that she was completely happy with the way it appeared from the frontal view. This is an example of looking at the side view. When prior to correction, you weren't able to see most of the side of her ear. After the procedure, we were able to recreate that bend and push back her ear. And this view is taken from the same orientation, so you can see how much it's improved, how much you can see the ear more. Prior to surgery, you weren't able to see most of the inside of the ear. After we bent the ear and also set it back, you were able to see it much better, so that from the side view and the front view, you can have a better appearance of the ear. And again, as you can see, you can't see any incisions in the front of the or the side of the ear, there's no evidence of any sort of surgery or some type of procedure. So otoplasty is a great way to change the way your ear looks for the better and decrease the prominence of the ear without significant incisions and visible incisions in the front. It can be done all through minor incisions in the back, and those incisions in the back heal wonderfully, and essentially you can't really see them. And those pictures that I took of the lady at the end were really at approximately a week and a half. So you can really get back to work really fast after an otoplasty, and so it's a great way to make your ears look a lot better. Thank you.